Our next presentation is entitled
in
the Driver's Seat, Digital Health Cars. Our moderators, Joe Perez, co-founder, Tastemade, and a board member, the USC Center for Body Computing, and Chris Tyberg, Division Vice President, Information Security for Abbott. They'll be joined by panelists, and no stranger to the USC Center for Body Computing, Dr. Dave Albert, founder, Alivecor, Sohel Merchant, founder in charge of vehicle architecture for eVelocity, and Peter Morgan, founder and principal, Clever Security. Let's welcome them.
Thank you, everybody, for coming. I think this is going to be a pretty interesting panel, but I think we actually wanted to start with a video. We're just going to show you a video that kind of gives you a little vision into what we're going to be talking about today, and then we'll get into introductions with the panelists.
Because we wanted to optimize our cars, especially for long distance trips, that when you get out of the car that you feel as good as possible. Not just safety and feeling comfortable, but to bring a holistic experience. And we call the direction fit and healthy. You have to push only one button, and we have up to 7 different comfort components which are carefully combined into a program. The Vitality Coach is an artificial intelligence-based algorithm which calculates what is best for you in a certain situation. Put your hands on the steering wheel. You have a pretty low pulse. Let's get you a bit activated, okay?
Sounds good.
You experience here a cool air breeze. You will smell a certain scent. You have a certain animation on the screen which brings you in a different psychological mood. It's the massage function, it's the ambient lighting, the scent, the ionization, the air breeze, and the seat ventilation. These programs are designed that they are not too distracting. You can do it while driving.
So at this year's CES, the biggest electric car announcement was from a company called Byton, a China-based company that wants to sell its car in the United States. And before we tell you any more about it, we're gonna hop in because we get a ride in it. The centerpiece of all of this, and I can't believe I haven't talked about it yet, is a gigantic dashboard-sized screen. It is 49 inches long, that's 1.25 meters long. It is a just endless screen. You sit in the car and it occupies your entire periphery. On top of that, there's also an 8-inch touchscreen tablet in the steering wheel, and Byton says that's coming to the production car too. You're actually controlling it either by the tablet on the steering wheel or through gesture recognition. There are cameras right below the screen that let you point and sort of move your hand around and pinch and do all these different things to move through the menus and open up media streaming or teleconferencing or navigation, all the things that you would expect in a futuristic smart car. There's so much more going on in this car too. There's a whole part of the user interface that connects to your wearables and will track things like your health. There's facial recognition on the side of the car that can recognize when you come up to the car and load up all your preferences and unlock the car for you. It's a pretty wild take on the future of cars, and Byton really wants to deliver that in the near future, which is really strange.
Yeah, so I think one thing we just wanted to start by just showing you some of the things that have been announced at some of the shows, and a lot of the panelists here have actually a lot of exciting things to share as well. But I think one of the things that's interesting is over the last few years, and when we started doing some work with cars as early as maybe 4 years ago with BMW and Mini Cooper, we're really trying to make a connection through the health and the car itself. So having things like a heart rate monitor, but then being able to actually do something with that heart rate monitor data, which was to actually change the music, or, you know, like they were showing on the Mercedes ones, maybe potentially change the ambient, you know, cabin air quality and whatnot. So I think some of the things that, you know, we've been excited about at the center is really trying to figure out, like, what would be some of these applications for health and wellness if you did have the car as a place to not only collect the data, but then to also be able to change that environment for people that, you know, are spending a lot of time in their car. So one of the things that I think we're going to, you know, I've got my co-moderator here, Chris Tyberg. I think there's two kind of big concepts that we really want to focus on today. One is thinking about the car as a potential way to, again, collect data over time, which is a big difference between using that data versus like, let's say, what a point visit might be. You know, when you go and get sick, you go to the doctor. But if we can collect data over 30 days, 60 days, 90 days, from you being in your car for 3 hours a day, there could be a pretty interesting story that we could tell there that could help influence your health. So that's just on the health benefit side. And then the other side that I think is of concern is, especially with what's been talked about today, is really how secure is the data, or how secure is the car itself from potentially being hacked and something, you know, happening where somebody can actually control the car, or could they do something where they actually are getting your health data? So I think those are some of the high-level topics we want to discuss, but I'm going to pass it over to Chris to introduce himself and talk a little bit about what he focuses on, and then let each of the panelists give a quick intro and talk about their thoughts on this topic.
Thanks, Joe. Chris Tyberg, Vice President, Abbott Medical Devices. Thanks for having me. It's been a great day. I appreciated the discussion on remaining optimistic and enjoying the journey. You don't typically find a lot of optimism in cybersecurity, and it's late in the day, and that also applied to my personal life. Father of 2 teenage daughters, who really hate it when I try to replicate their lingo, and so the thing that I thought about today was Dad, you're such a fun sponge. So we're going to have a discussion on cybersecurity today, and we're not going to be a fun sponge about it.
I'll stimulate the daughters, and he'll be the fun sponge.
Yeah. So I do think that it's a very exciting time in cybersecurity. I've been doing this for 20 years, mostly in healthcare, but also in a lot of other industries. And you think back even 3, 4, 5 years ago, and when we thought about cybersecurity, we a lot of times thought of a compliance perspective on it. Many of you have probably taken the compliance training that you get, which essentially is, have you read the policy? Do you agree to the policy? And are you going to follow it? And it's really compliance. It's not security. And I think in the last couple of years, for the first time, we're having engaged discussions with many different stakeholders. So at Abbott, we're talking to physicians, and physicians are really interested in this topic, and they want to learn, and they want to engage in it. We're talking to hospital administrators. We're talking to software developers and lots of different groups. And we're talking about things other than compliance. We're layered security, and how do we build it in up front so that we know we're using secure devices, and then a lot of other things. And if you have a chance, and earlier they announced the Health IT white paper, things that I think ensure the security of the future, like workforce development. We need people in the future that understand this and can help us build these things. So very excited to be here and looking forward to the discussion.
Dave?
Well, you mentioned 3 hours in a car every day, so obviously it's about LA. But, I look at it, we have a lot of conflicting movements. At the same time, we watch the Mercedes guys say, put your hands on the steering wheel so you can measure an ECG and give you heart rate. At the same time, we have autonomous vehicles. Less time putting your hands on the steering wheel. We have devices like the Apple Watch that can measure your heart rate and things of that nature. And so why build it into the car if it's already on the person all the time? That's the old notion of I get in the car with my cell phone and it's automatically connected. Mm-hmm. So these are different notions. And by the way, we have shared rides. So is this what Uber and Lyft are going to be interested in so that they can track the performance of those people who are their contractors? Because I think fewer of us are going to be driving, and we're going to be driving less, at least generally. So these are kind of different movements, and I think we have to look at all of them. And also, why? Why, if I'm being monitored by my personal devices in my home, why does my car need to monitor me? So these are all things I think of it in the abstract, but we need to think about them.
Yeah, and actually those are good points, and I think Sohail will talk a little bit about, let's challenge the concept of what a car is. Let's challenge the concept of what an automotive car manufacturer is. Are they a transportation company, a mobility company? Look at an Uber. They're doing scooters just like Bird is doing now. They're doing bikes. I mean, it's not about necessarily being a car manufacturer and actually just having people drive those cars. who's the passenger, what's the form factor, what's the car going to be, and I think Sahil, you'll share too.
Yeah,
that
I mean, the important point is really recognizing that change and addressing that change, right? That's the point.
yeah.
And the American College of Orthopedic Surgeons loves birds. I can just tell you that right now. Business development.
Peter, you want to do a quick introduction?
Sure. I'm Pete Morgan from Clever Security, and I'm kind of the security research component on the board, I think. And as Chris mentioned before, I'm going to try not to be too doom and gloom about, what could be done with these new developments. And I just see things through the lens of security research. And I get hired to break into things and find new ways to break into things we haven't found before. And while it's really fun, you can't help but see ideas like this through that lens. And if you look at cars of the past, really 5-10 years, they've exploded the amount of software that's on them. My car drove me here today, and I don't dare look at that system because I don't want to know the depths of how it works. But the amount of things that are happening on the software level on cars now is exploding just over the past few years. And with that comes attack surface, and with that comes additional implications from a security perspective. So trying to be proactive and trying to be optimistic about what these things can do, but also realistic about how an attacker is going to go after them and what they can do when they get that information. And as we've seen with other developments, it's you can make something very, very hard to break into. It'll never be completely impossible, but you can reduce that through a series of design decisions and learning from the lessons that we've learned in the past 20 years. There's a lot of lessons to be learned from history and how to approach the situation in a proactive way.
Sahil?
Great. My name's Sahil Merchant. I'm in charge of vehicle architecture at eVelocity. Yes, it's another electric car startup that we started in December. I've been in the automotive industry for quite a while, and half that time's been spent in Detroit. I've done my time there at Ford. And I was at Tesla for many years. And, after I was at the startups, I realized, we want to do something meaningful, recognize the change. How do we do this? And looked around and didn't really find anything. And so we got a bunch of people in my backyard and started, one thing led to another, and we sort of started a company back in December. So I'll just go through a couple of things that sort of, just to give you a background of, what we're doing really. We started with the idea of really doing something affordable, meaningful. We've grown quite a bit since we started in December, but I don't want to bore you with the details of the company really. But one of the things, taking off the points that were raised is really recognizing sort of the shift, right? The millennials, you keep talking about those guys, but it's essentially the shift for all of us, right? And recognizing that shift is important, and sort of important that sort of how does that shift, come and meet our needs. And so currently with recognizing that and recognizing the flexibility that the electric architecture gives you really lets you do many different things, and we talk about that in a second. One thing, our motto when we started was really a reckless abandon of convention. So going right into that, if you look at cars, in fact, for the last 100 years, right, from the time you had horses, you had the horse in the front, you had the cabin in the middle, and you had the carriage in the back, right? And not much has changed. Software, things have sort of gotten crazier, but I thought I was in my autonomous car as well today, right? And suddenly it came to a complete stop in the middle of on 110, so we're a long way from full autonomy, so we got to recognize that. But if you look at consumer electronics, right, even in the last 15 years, you've gone from sort of, the Nokia phones to Apple Watches. You have this generation now that's going out at night without their phones, just with their watches. And so what you also start to see in the sort of, the startups that you look at around is it almost feels like you're walking down Vegas, right? You have these big screens and things like that. And is that sort of what people want? Maybe. But what you see from the devices today is the devices have gotten smaller in your houses, right? It's voice. And so one thing sort of we're looking at is what I talked about earlier, is the electric platform affords you the ability to not necessarily conform to the norms of design that we've had so far. Really take that space that's occupied in the front and the back and put it inside. The other thing sort of, we're exploring and looking at really is today cars are really jack of all trades, right? It doesn't have to be like that, right? We're looking at sort of skateboards and top hats. So the things that the car that you use for rideshare may not be the one you need on the weekend. So how do you address those needs? And sort of, tying it right into the wellness, right? Essentially, the point that was brought up here is really, do you need to be monitored? You have your clothing will have biometrics, your watches will have it. But one thing we recognize is, as an example of brake dust, you're on a stoplight or, stop signs, the biggest issues are brake dust, right? So having clean air is important. And so we're really looking at the ABC's fundamentals, air, breathing, circulation. Yeah, could we have sensors in cars? Sure, but let's figure out what we do with that. Yeah, and quit smoking.
Yeah, so maybe we start with, I think, what do we think the real kind of killer app is for something to do with the health side? Forget about the security for first and foremost, but I have my own opinions on this, but I'd love to hear what the panelists have to say on what is really going to be the difference between I already have it on my phone, I already have it on my watch, it's up with me all day versus 3 hours or 1 hour. So what do we think? I mean, and Sahil, maybe you can start and then we can pass it down the line here. But what do you think is really going to be the app that's going to make people see value?
Yeah, I mean, sort of recognizing from the use case down to the app, right? So one of the things I didn't touch on is really if you're in the ride-sharing environment and you have this person that's super sick or sneezing, do you want things to clean that up, right? But the other side of it is also once you're riding, do you want a gentle nudge if, for the choices you make in life? For instance, if it detects potentially if your heart rate's, a resting heart rate's really high, should it nudge you gently? So, and the apps potentially in a fun manner, gently nudging you towards that would be a great start. Now, the app could live on your phone, on your car, or it could just be a voice nudge.
Yeah, and Dave, do you have any other thoughts on in terms of measuring? What should we measure? I think that's a big question.
I think, personally, what I would want to see, we're still at the 40,000 road deaths a year in the United States. Let's have an emergency capability. If I notice that my driver is incapable, that our autonomous vehicle safely pulls over and calls 911. Like the function on the new Apple Watch. If you don't respond, oh, by the way, are you all right, Joe? And you're not all right, it pulls over, it's safe, you don't pass out and go into the opposite lane. So that to me, would be a function of some value. And especially if somebody, you don't have to be old and have a stroke. You can be incapacitated because of drugs, alcohol, the major reasons. So I would see that as a real potential benefit to in-car monitoring combined with autonomous capability.
But really building on that point, I think, and that's a great point, right? And cars actually have that capability today already, and they've had it for a few years, right? But pulling on the side, it's happening. But I think on top of that, if you had some amount of biometrics and first responders could tap into that, now suddenly that becomes an important use case as well. And that's sort of the things we're really looking at and recognizing that let's figure out what it is for, not necessarily jargon of information or getting it too gimmicky.
Yeah, and I guess my question would be, do we think are we still far away from the concept of this almost pervasive data collection and then trying to tell stories from that versus, I thought when we were talking about this at the center, we were thinking that we really need the killer app should really be safety because most people, even if you just take texting as one example, and I think Sahil, when we were talking with you guys, it was all about, there are so many sensors, like a mirror itself could detect eye position, and if you're looking down to text, well, if I could keep the driver alive and I can keep everybody around them alive, that seems like an easily marketable killer app, right? But then the question still is, to do this, to really take it to the next level is, can the car be like a virtual clinic, a pervasive virtual clinic that's collecting data over time? Much like all of the stuff we've been talking about over the last 12 years, there's a difference between, again, a point visit when you're sick versus the concept of what we've been talking about today, life care, and being able to say, no, I collect data over time, I make small changes over time. It's more a combination of wellness and health care. So I think that's kind of my question there. Is it really just you're going to focus on safety first, or do you think there's a way to start building a narrative?
If you're talking about even in LA where you spend a lot of time in your cars,
yeah,
you still spend a lot more time in your bed. So if I want to monitor somebody longitudinally and I want to monitor them intensively, I want to do it when they're sleeping because they spend way more time in bed than they do in their car. Unless you live in some parts of LA. So I just look at that and go, I'd like to, the safety is the killer app. maybe the clinic part, but again, if we're going to be monitored continuously with wearables, then our car should be, we talked about standards earlier, should be able to accept, forward, and maybe interpret some of that data. If all of a sudden my watch says my heart rate just went to 200, okay, and by the way, I'm 70, it needs to pull over and call 911, okay? And so those are the kinds of things I think we need to, I'm not ready to put a defibrillator in the seat yet, but I think, those are not science fiction. Those are real. We can do that today. And I think it would improve the general public safety, whether you're driving yourself to work or whether you're an Uber driver and you've got somebody in the back.
Yeah. Just to keep on the safety track, so talking a little bit more about the attack surface, as you mentioned. So now that let's just assume these cars do have obviously more electronics, more software. What do we think is really, from a safety perspective, what do we think is really the dangers there, from what could happen from hackers outside and in? I guess Chris and Peter, you can tell us about that.
I can start off, and then Pete, you can jump in. But I think that this whole concept of the patient being at the center and it's being about safety is I think really, really important and critical. I think that's been a theme of the day. The other thing that I heard a lot of people talking about is, in order to gain these benefits of connectivity, and we know that there's benefits of connectivity. There's been studies done for many years that show when patients are connected, they live longer, they live better. But in order to get those benefits, we have to have the integrity, the reliability of the information, and the availability of those systems, and that's kind of a central piece of what we're trying to do from a cybersecurity perspective. It's many people. One of the biggest reactions I get out of people is when I tell people that hackers have conferences. So just like we're here today, hackers have conferences, and it's not. You think, oh, they have a conference. It's probably like 50 people. No, it's 30,000 people. They take over Vegas and they tear apart cars and they find where the holes are and they do with a bunch of different stuff. One of the positive things we've seen in recent years is industry, bringing those people in and aligning with those people and working with that community to learn how they do what they do and then incorporate those protections into the products and in the devices. So Pete, maybe you can kind of, you do that work. So maybe I think it'd be interesting for people to hear kind of how you think about taking stuff apart and doing that, and when you look at these devices, what do you see as the big challenges?
Yeah, so it's a pretty generalized approach. A lot of times when I start a project, I work in an area called black box security. So they just send me something, and I don't really know anything about it. And that could be something this big or something the size of this table. And I start taking it apart and evaluating all of the components in it and taking apart the chips and finding somewhere where software runs on it and some sort of interface that accepts information. And you just keep doing that until you figure out how this thing works. And then a process called reverse engineering where you can actually read the binary code and interpret what it's going to be doing on the software level. It's kind of challenging, but spend a lot of time there. And by the end of it, you have a model for how a developer made a device, a thing. And along the way, as you're building that model in reverse, you start noticing these security axioms, and they're things that they're facts that the system hinges on, its successful operation hinges on. And if you can flip one of those facts or turn true to false, the entire security of that system may fall. So a great example is, for those of you with iPhones or Android phones that update your phone, that over-the-air update, that firmware update is an extremely security critical component. Because as an attacker, if I can jump into that, if I can compromise that workflow, I can insert my own code into your phone. And then the first piece of code I'm going to insert is don't let anyone else update it again so they can't regain control. So if you think about that like in a vehicle context or in any sort of embedded device, there's a lot of these little linchpin ideas that if we can get right from the start, we're going to save ourselves a lot of time and trouble. And we've seen examples of this done very well from the start, from a design perspective. and examples that unfortunately did not learn from history and are kind of going through that process of fixing along the way. And I think that one of the major things that, with this is whatever the decisions that people are going to make for what these products are going to be, I am definitely not qualified for that. The design decisions they make at times like this, like right now, before they're developing code for it, before they're making these products and marketing them, are going to define how they handle secure information. And more care should be put into those design decisions now to prevent the normal life cycle of build a device, take it to market, hire hackers to try to break into it, and then fix it in patch releases. That's kind of the typical model that we see in product development right now, because one of the challenges of product development is being first to the market, or getting to the market as quickly as possible. And that is at direct odds with doing it securely and correctly. So trying to see the benefit both in a time investment and a cost investment of making those decisions up front rather than trying to fix them on the backside is a huge change I think would really benefit, especially in the vehicle space.
Yeah, so Hill, I think just going back to some of the other benefits, I know you guys have spent a lot of time thinking of health as a real differentiator for a new, because the market's obviously crowded. There's a lot of different features that people are pushing. What can you talk a little bit about kind of your philosophy on? I think you mentioned the ABCs, but just give us a sense of what you think could be, because again, I think it's about, is there really enough value in what you're providing that people are willing to either give data or be able to see, oh, that's beyond safety. I think this is actually a kind of a killer app.
Yeah, absolutely. I mean, like it's been said that data, if you collect data on people, it sort of has statistical evidence that it helps, right? But ultimately, there's the debate. I think at the previous panel, Josh Walker mentioned, right? We've got to spend a lot more time figuring out what it means, right? And so we're, not at the center of that, right? We're sort of trying to sort of integrate the technology, but what we are completely aware of is really trying to make it fun. We don't claim in saying that if you drive these cars, you're going to live for 150 years, right? But the idea, at least we have currently, and we're a startup, we'll continue to evolve that, is really to see in a fun environment, right, that it really isn't fun, right, being in a car on 110. But if you can make that fun, and through gentle nudges, right, all of us could use a little bit of a push. If you can affect your choices, may it be measuring your heart rate, could determine your resting heart rate, which could determine your fitness, which could determine your choices, right? So if you can have these nudges along the way, that could potentially lead to better choices. And coupled with that, I talked about the rideshare case where we make sure that we address the things, right? You don't want to get into a stinky car. You don't want to get into a car that's completely polluted with viruses potentially as well. So recognizing that. But we're sort of evolving in that thinking as we move forward.
Yeah, and I think there's, in terms of how do you think the other benefits of the way you guys are positioning specifically about the car is more than what it maybe was before? We talked a little bit about in the past, I kind of use my car as my office, and it's like my sanctuary. Because I can actually have a more peaceful conference call in my car than I can actually in my office. But there's cars in office, there's cars as service. Could it be the future of EMT, or it could be the future of EMT plus services like a CVS mobile car acting as service? I mean, those are the other things that I think you guys aren't thinking about it just again as a passenger driver. You're thinking about it, service vehicle. And
yeah. So I think we're looking at two things, right? One is obviously the product, understanding that, right? It's the ride sharing, the delivery, things like that. But the other side of it is the whole business model, right? I mean, a lot of things are moving away from things from ownership to sort of models where like music, for instance, right? We used to have big libraries. I used to have hundreds of CDs, and now it's sort of, I don't own anything, right? It's on Spotify, for example. Same thing with cars. You could sort of see a model where you have a monthly payment potentially, right, that could be shared between ride sharing, could be a parking, could be a cars, and could be multiple cars. Now you're seeing that today already, right? Porsche, BMW have these services, they're expensive, right, where you can choose different cars. But we're exploring that where sort of in two ways. One is obviously having the choice, right? The car that you drive to work may not be the car you're going to take mountain biking when you want to load your bike, your bike onto the car. But the second sort of piece of that is the whole monthly payment of that experience, right? If you could evolve that and put that all into one sort of payment, would that help that experience moving forward? So we're obviously looking at both sides of it, business as well as product.
Yeah, and I guess from your perspective, Dave, I really am still trying to understand besides safety as the killer app, because I think, again, there's a differentiation between what you're wearing on your wrist and your phone and pervasive data throughout the day versus sleep. Do you think of anything that when you're in the car and in that state of mind that is a different piece of data that you would be, obviously sleep data is a very specialized, information, and you want to see how deep people are getting to REM. Is it restful sleep? Is it 7 hours at least? All that stuff is very specific to sleep, but do you see any advantage? Because I'm still trying to find, in my head, what could be a killer app besides safety?
Well, first of all, we're talking about cars. When I would think, we've had some high-profile train accidents, bus accidents, truck accidents. So people who have more than just themselves at risk, these are opportunities where, whether it's evaluation for the mental status of somebody, those are applications that I think, again, along safety lines. Because remember, it's traffic safety. It's safety is a big thing beyond entertainment. We've putting screens in cars. Been in a lot of Teslas, but putting screens in cars can be a real distraction if you're trying to drive in traffic in LA. Okay, and it's not standstill. I just look at it and say, safety first, and then the question is, if I generate biometric data that is of some value, these two gentlemen are going to come in because that data cannot live in isolation in that car. And by the way, it can't even live in isolation as the car data in the cloud. It needs to be integrated into the information so that Dr. Saxon and my wife can use that data. And that means that it's to be integrated in the EMR. And does that mean the car is going to have to know fire to upload? These are all the questions that have not been entertained. But we got enough silos of healthcare information. We don't need more. And so I would say those are the kinds of questions that need to be addressed a priori before we start instrumenting our cars beyond the safety issue. That is the safety of driving.
Hey, Dave, I expect, it's Leslie down here.
Wherever you are.
At the stage. I expected something totally different from you. As a guy who's trying to get cardiac rhythms diagnosed and could easily put a sensor in a car, easily pick up AFib that's asymptomatic, easily prevent strokes quicker. Big problem we have, is untreated hypertension. People are having strokes 10 years before they should. If you're in a car with all these sensors that has an entertainment system, the car takes your blood pressure, everybody resists that first drug. It's white coat, it's whatever. That car plays the Grateful Dead because it knows you like the Grateful Dead. It takes your blood pressure again. It takes it down. Great, monitor it for a while longer. It doesn't take it down. It goes higher. You go to your doctor. The patient drives that drug prescription, which is the only way to get adherence, mostly, right? Now you've got patients coming with their hypertension diagnosed, knowing their entertainment system in their car can't bring their blood pressure down. One drug doesn't control it. They're coming to you for the second drug. Never happens if you're pulling that from a patient.
I don't disagree, except
this is a virtuous world we're creating.
So let's make an instrumented bed, because then it's totally. Anytime I have to be active, whatever it is, I have a compliance issue. If it's passive, so passive data from your car. I mean, the car can be a very stressful place. We can have stress in lots of places in our lives. I'm just looking at it. Is it an optimal place? And by the way, Leslie, we know the prevalence of atrial fibrillation. It's very low, except and it rises exponentially after the age of 60. And by the way, I'm assuming, I don't know the facts, that driving decreases after the age of 60. So you have the increase. So where's the best place? I think the best place is on the body. That is ubiquitous biometric. And that the car could be one aspect of it, but I keep coming back to safety as the killer app.
Yeah, I think the point of argument, right, to Leslie's point, she's always said, and we've talked about this, right, the car is a great teachable moment, right? You're forced to be in that space anyway. But the other view of looking at it is it could be the most stress-free place if you're not behind the wheel, right? You could be behind in the rear seat, and that could be a really beautiful experience, right? It could be a living room, for example, right? There's no limitations of thinking like that. So now on top of that, and that could be a bed with the sensors, because who's to say you can't sleep back there while you drive? There's nothing that, there are safety implications of that, but truckers do that, right? So I think if you recognize that you have to be in that space, like it or not, for an hour to work or whatever you're doing, it's a teachable moment. let's, get to that and sort of figure out what we can do. Obviously, I'm no expert in that area. Once you guys agree what to do with that data, we'll do it.
But again, I would just say, if we're going to gather that data, please don't let it live in isolation. I mean, we have enough silos. I mean, I fight that battle every day that my data is living in one place when it needs to be integrated. And we all know, and this is a joke, but not really, that we have an epic data sharing problem in healthcare. And or a healthcare data sharing problem of epic proportions. And so what I would say is, please, let's make sure from the beginning that if we're going to generate data to make it useful, we need you, Leslie, to be able to have access to it and to integrate it with the Apple Watch data and the Zeopatch data and all the other data that relates to it. So I'm anti-silo safety first. Okay, if that makes me bad.
Okay, so one more point. So Dave, when I first started using your sensor, we were investigating it. Some healthy young guy had a malignant heart rhythm that we both saw in the middle of the night and scared the hell out of us. He didn't die. We found out he had an inherited ventricular tachycardia syndrome. He thought that his dad died on a road in Texas because of a drunk driver, and his dad probably died because he had it too. But if he would have been in a smart car, he would have gotten defibrillated by a seatbelt. I mean, to fully iterate this.
I'm with you.
A lot of these sudden deaths, there are 250,000 sudden cardiac deaths in this country. I'm just saying, and a lot of them occur if complete, you could actually probably impact health outcomes.
That's part of safety. I mean, if it noticed that as I said that, if your heart rate went to 200 or went to 0, the car should pull over and call 911. And maybe, again, I'm not quite there at the defibrillator yet. We just had a failed trial in New England Journal of a wearable defibrillator, so I'm not sure about, as you well know, the VEST trial failed. So I'm just saying, I agree that the cars should be vigilant about the drivers and maybe the passengers. But the question is, that data, safety, that's still I consider to be safety. That's safety of the driver and safety of the people around them. Yeah. So I agree with you.
Fair enough.
That's a good application.
Yeah.
On the data silos component, I'd love to hear from Chris and Pete about the whole concept of, okay, now that's not really hacking in the car and controlling it, but now we've got data, and it does need to probably be, in the cloud and somewhere. So what's the concept around how do we protect that, or what if this goes down that path? What are your thoughts on that?
So one of the things to think about is the traditional, like the cars you drove here today in, on average, have a very poorly secured network of how they operate as a car. So when you design a product and you're going to take something like medical information or personal health information into it, and you're going to put it in that environment, you have to treat it like a hostile environment, because that is what it is. As an attacker, I can do all sorts of interesting stuff in that environment because of the design of it. So as we make these things, we're going to collect information, we're going to store it and send it places. The chain of that sequence needs to be well designed. And a great example is if you look at Apple's iPhone. They have a secure coprocessor in the iPhone that all it does is manage your Face ID and your Touch ID and your passcode. And they developed their custom thing, and it was very expensive for them to do that. But that demonstration is having some reliability on the hardware level for storing information securely. And that's a pretty complex thing, but I think that idea needs to be adopted if you're going to take health information and store it, because in some of the videos they were talking about, they were doing things like face recognition and iris recognition. And just as an example, hypothetical, we know what the information is on someone's phone. If you hack into someone's phone, what you can get. What if I could hack in your car's face authentication system, steal that auth data, and then replay it to your iPhone to unlock your iPhone? As you gather more information, you're responsible for a lot more things. Yeah. And I think you have to be very cautious with, again, like I thought you made some really good points on what is the utility of this. And if there's some great utility, then by all means do it, and let's design something secure from the start. But to just gather information without a stated goal in mind, I think would be dangerous, because it is hard to do this correctly. It's very possible, but it takes diligent work from the start to get this securely designed.
Chris? thoughts.
Yeah, no, we're running out of time. We're between everyone and the Trojan Martini. So, I think that the key is like Pete said, it can be done right. I think there's more focus on this than there's ever been in the past. And I think if we just continue to make sure that we think about that there are benefits, right? And again, let's not collect everything for the sake of collecting everything, but we know what the benefits are, and we focus on that. Just like medical devices, we know people live better, they have better lives. These things save people's lives. Cybersecurity can be very scary. We don't want to get to the point where people stop using things that will save their lives for reasons of cybersecurity. So I think a lot of good things are happening and continue to happen.
Yeah, so I think we'd open up for any questions you guys might have for the panelists. We got a few over there. Mike's coming here.
Hi, this question is directed toward Chris and Dave. What would be your impression of the advantage, if there's any to be had, by utilizing edge and fog computing in addition to cloud computing vis-a-vis a safety vehicle or pathway?
Well, for instance, and I get Dr. Mike O'Reilly here from Apple, but the new device that does fall detection, you have to be over 65. You have to tell it you're over 65, because that's where the risk goes. Again, we know the prevalence of lots of problems, AFib, falls, cancer, everything. We've got lots of good data on that. And so age, gender, I mean, there are lots of things that change your pre-test or your prevalence, pre-test probability or your prevalence of any given problem. So I think if your car knows, oh, by the way, here's a simple one. Here's a really simple one. You go from being a Kaiser to a USC Keck patient. Where's your data going to go? You got to tell your car, okay, by the way, now I'm a USC Keck. It's got to go into Cerner instead of going into Epic. These are real-world problems that today we don't have a good handle on. And so, it may know your age, but it doesn't know where the data is supposed to go.
Sorry, actually I said fog, F-O-G, and edge, E-D-G-E. That's different than fall. My bad.
Oh. It's my age-relating hearing deficit.
Oh, I'm older than you are.
Presbycusis. Yeah. So, somebody else?
Chris, Dave?
When you clarify a bit.
Well, I was curious to know if you have or had an occasion to work with edge computing / fog computing as it relates to cloud to thing.
Yeah. Oh, okay.
As a means of enhancing security.
Yeah.
Is that something that's come across.
Yeah, and I know, and you always hear a lot of people talking about cloud, right? And I think one of the good things that's happened in the last few years is a few years ago, you talk about cloud, people got really worried, right? Oh, it's going to be in the cloud, put all my data in the cloud. And I actually think, a lot of cloud providers that do really great job of security. They do amazing job of security. There's a lot that don't, and we're all on the map. And so I think that you look at, it's interesting to talk about the complexity of healthcare and the various pieces of it. I think it all has to work together. There's no, I don't think we're ever going to be a spot where it's all in the cloud, and we're never going to, but we're not going to be in the traditional model of data centers in every company and every hospital. And so I think that the challenge is getting that all to work together and talk and integrate, like you said, so that you can share the data and we can get access to the data and the people that need to see it. And a big part of that too is engaging the patients. I think that was a big discussion today, and how do we engage them?
Great, thank you.
There's a guy in the back.
So one more thing on that, just as an idea. We're talking about building sensors into cars and making this kind of complex network and that can gather all this data and hopefully help us with it. What if those sensors were just connected to your iPhone or your Android phone? And they're on the car, and maybe they're powered by them, and there's aspects it can do, like send a certain message to say there's an issue, pull over, call 911, that kind of thing. But the data was housed on your healthcare app on your phone. So in your example, when you switch that healthcare provider, that's something that could be known by your insurance company and modify that to send the data to the correct place. But it's all kind of lives in another place because, again, we're really making a lot more complexity in the car, and there may be a great design decision to do that. But it's a lot more to manage too. Like the amount of firmware and software updates is going to happen to your car as a result of these expanded devices that each have their own code. That's not trivial.
Yeah, I think that's like an architectural decision for designers, Sohail on your team, but also it's just the concept of what will the consumer expect, right? Because in the old days of MP3 players, there was the early ones like before the iPod were the Sony one where you had to like put in 5 different cards and turn some dials and wait for planets to be lined up before it actually got music to your thing. Just completely unusable. And so the question will be here is maybe to your point, Pete, is it going to be like the consumer will demand that it's just on their phone as opposed, and then it does pair with the car, right?
And that's exactly sort of what we're looking at, right? I mean, you see this threshold of, the abundance of computers and technology in cars that doesn't have to be like that. I mean, I can't really disclose what we're sort of doing, but we're really looking at minimizing that experience. I mean, right in line with sort of what you're saying. And it really goes down to the point I said about recognizing where we're headed. I mean, phones are getting more powerful. By the time we launch in 21, it's going to be even more so. And so what is the right choice? But we do completely recognize that the right choice is not necessarily having the biggest computer in the car, for sure.
Yep.
There's a guy way in the back.
Any other I think we have a question in the back.
Hi. This could be a question for Dave. Is there clinical advantage in having data, not just like heart rate, but like galvanic skin response, which tells you like Mondays are more stressful for a person than Tuesdays? So we can then change the ambient, going back to the Mercedes point, where we can check the stress level of a person, put them in a stressful condition of driving a car, and then make the ambient surroundings in the car itself work towards reducing the stress level. And just one more question, Chris, and is there advantage to moving to an open source blockchain type network for storing all these data for vehicle health related data or data in general from a security perspective?
You just didn't mention AI. You mentioned the other hot words. You should have thrown AI in there. Blockchain. All I would tell you is, yes, we can measure almost everything. Galvanic skin resistance, we could turn it into a polygraph, essentially. And I think it comes down to what's the real value. In that video in the beginning, remember they were modifying the environment through the air conditioner system, and it's going to be something more than air conditioning. So I think you could have thermal sensors, infrared. You could take the temperature of the driver and the passengers and figure out the optimum settings. So I think that's possible, and the question is it practical, and is it needed, and will it make a difference? So I can't answer those questions, but it's certainly possible.
I mean, adding to that, really, if it's recognized that Monday is the most stressful day, you probably shouldn't be driving, right? Maybe that's the day you ride share. So, I mean, that sort of, again, comes back to the point of recognizing, why would you drive then?
That's the kind of information I was referring to. If we get that kind of information, we can proactively ask the user to not use this car today or nudge him to go book a ride share.
But I think, Dave, to your point, I mean, it's one of those where it doesn't have to be the car. I completely agree, right? But it's a balance of what's right on the car, what's right on the bed, what's right on your hand, potentially. But yeah,
I mean,
you'll always need a car to get somewhere.
You could get in your car and it could potentially do a breathalyzer, a passive breathalyzer, and it knows that you're going to blow something close to 0.1 or whatever it is, and not like the cars of the alcoholics that make you blow in before it'll turn it on. We could do those kinds of things, and those are safety issues I think are important. Or it could monitor your retinal responses. These are possibles. I don't think any question. They're not science fiction. So they may be things that different people, entrepreneurs, have an unlimited ability to innovate.
I mean, if you really want to address deaths, right, the 40,000 number that hasn't changed for years, right? I mean, I think China is getting it right where it's sort of, there's the school of thought of autonomous, right? You can put 20,000 sensors in your car, or you can make the infrastructure smart, right? It's hard to do that, but you're starting to see this in China where you have cities that are sort of embedded infrastructure sensors around, right? So the car is simple. or simplified, where you have machine-to-machine communication, right? So I think it's going to take us a long time to get to that point, but the real answer is we have to get the horses off the roads, right, to really get cars on. We'll have to get the manual cars off the road to get full autonomy, to have no deaths.
So will you join me in thanking this distinguished group of panelists and great presentation?